All right, good morning, everyone. My name is Xiaofei Zhou, and I'm a NSF AR/VR PhD fellow. Thank you so much for joining us this morning for Voices of XR with Dr. Ram Haddas. This series is made possible by Kathy McMorran-Murray and the National Science Foundation as part of the interdisciplinary graduate training in science, technology, and applications of augmented and virtual reality at the University of Rochester. First, I would like to thank Dr. Haddas for joining us today. Dr. Haddas is an assistant professor in the Department of Orthopaedics and Center for Musculoskeletal Research at the University of Rochester. He specializes in the care of patients with musculoskeletal and neurological disorders. His work tends to highlight the respective impacts of conservative and surgical interventions on a patient's quality of life, pain levels, psychological features, and function. At Rochester, he is developing world-class motion labs that leverage XR technologies for clinical service and research and development. His educational background includes a PhD in clinical biomechanics, a master's degree in mechanical engineering, and an MBA degree in operations management. Please feel free to post your questions in the chat. We will have an Q&A session at the end. Lastly, this session is being recorded and will be available to you later on the Studio X website. With that, I'll turn it over to Dr. Haddas.
Thank you, Zoe, and good morning, everybody. And thanks again for Studio X for the opportunity to present my work and my vision over here. So today I'll talk about orthopedic and extended reality and how it's related to healthcare facility. First of all, this is my financial disclosure. None of it is relevant for this talk. So a little bit about myself, like Zoe mentioned, I'm part of the orthopedic and biomedical engineering department here at University of Rochester, and the most important, I'm a faculty of the Center of Musculoskeletal Research. On top of that, I have my own consulting company, that consulting for medical device company, and provide some expert witness to some lawyers and insurance companies. Before that, I actually worked 7 years in a private spine and neurosurgeon hospital when I actually was initiate and design a motion lab inside hospital facilities. My personal interest is spine research, so I'm heavily involved in spine society. Here's brief objectives of my talks today. First of all, I'm going to give you a brief overview about my career trajectory and how it's led to where I am today. Then I'm going to jump right on to the existing extended reality technologies for healthcare and researchers. And then I'm going to give you an overview of our new facility that we're building here at U of R and see how we're involving virtual reality in these facilities. So let's start with my career overview first. So I started my career at the military as a combat engineering. Unfortunately, after 2.5 years, I got severely injured in my back and spent months in our rehabilitation facilities. Spent a lot of time with physical therapy, with clinicians, a bunch of hydrotherapy and other type of every possible rehab that would exist back in the time. Unfortunately, I couldn't get back to the battle, so I actually got transferred and become a Krav Maga instructor and finished my duties in training new soldiers in the boot camps. This led me to my master's degree in Indiana University when I actually was focused on tactical athletes and sports medicines, performance emphasizing in biomechanics when I examined lower extremity injuries and low back pain injuries, these things. Later on, I pursued my PhD at Texas Tech University Health Sciences Centers, when my dissertation focus was on low back pain patients, when I actually attempt to build a virtual reality world with a very low budget, which ended up to be a light board that connecting to the force plates to create some reaction time to mimic some game simulation. Then I picked up my first job at Texas Beck Institute, working with 21 spine and neurosurgeons, work closely with physical therapists, psychologists, and nurses. Over there, I developed a quantitative method to quantify patient sway and balance, especially in deformity patients, and I got several publications and awards about this topic. So let's jump straight on. What our extended reality products are out there and available. So when I did prepare for this work, I actually found a lot of information. So I choose to focus on 4 domains and present several companies. And the domains are education, surgery, telemedicine, and rehabilitations. I'm going to present about several companies over here. All of them are FDA approval. There's many more companies out there. Those are not the best companies, the worst companies. It's just the one I found that I thought going to be very beneficial for you to get introduced with. So let's start with education and how education of medical training got changed in the past couple of years. So I know when I actually studied for my anatomy classes about over a decade ago, excuse me, I actually used a 2D textbooks, right? Study all the structures of the anatomy, then took a quiz. And only if I took the quiz and passed the quiz, I was able to go down to the sections groups and try the sexting simulation. I remember my professor always told me, you need to have a good 3D perspective to pass this class, actually, and try to visualize these things. Now with virtual reality, the medical training changed significantly. We actually, in Studio X, we have a similar system of the AR goggles, and we have the apps that you're going to see in a second, that allowed us to visualize a different human anatomy system, like a skeletal system or musculoskeletal system. You can actually go into deep analysis and see what kind of components are actually in skeleton. This technology, I'm going to show the video over here. This technology is actually available to us at the
Human
Studio X,
Anatomy
like
VR delivers.
And what you can do, you just put the AR headset on and go and explore whatever system you want to explore. So here in this example, the skull, you can just break it to components, take one segment out, rotate, look, feel it here, see what it does. You can actually double click on this thing and tell you exactly what the purposes of the skeleton. You can easily jump to the musculoskeletal system, looking on all the different muscles that they have, see the origins of the muscles, see the insertions, go even deeper to the colony without being very precise in your dissections and try to hurt or cut or not cut basically nerves. If you are local in Rochester and you didn't visit the Studio X, please go and do that. They have access to this software where you literally go to the patients and have like an X-ray vision, go deeper in the patients, taking apart all the components. If you would, if you like to choose to study one more system than the others. Obviously, looking on the veins, on the nerves, how everything activated. One very cool thing I like about the software is it actually changed how we study applied anatomy. So right now you can actually go and choose specific muscles and then show you what the muscle is doing. One more cool feature that's kind of new is get radiographic or imaging features to this thing. So you can go and dive in. For instance, this is a dynamic MRI, and go see how an MRI scan look on the patients. Basically, you can go deep, you can go hard, analyzing soft tissue, muscular tissue, and etc. Then if you won't go to the details, you can see exactly how the muscle fibers are building, how the bones are actually, the components of the bones. And then, like I said earlier, the applied anatomy changing. Right now, you actually can see, you can choose a muscle and see exactly what the motions the muscles are doing. Yeah. So again, this virtual reality literally changed the way we're learning anatomy. If you're local, please stop by the Studio X and try this thing. It's really fun. I actually tried by myself. I brought my kids over there. Just one thing after you're done, just make sure to put everything together, to put the person together. Then beside these educational tools, the VR also can provide, can serve as an empathy tool for doctors. You know, it's pretty challenging, especially for medical students, to have a similar feeling of how a dementia patients feel like, or how Parkinson patients feel like. If you never had a migraine or a headache, I mean, you don't have idea what your patients are going through. All those situations can be simulated with a VR and can help a medical trainee to better understand the patients, what the patients are going through. During the simulation, the medical trainee or actually physician can experience having specific health conditions or being in a certain real-life situations where they can develop some empathy and can help and can be more engaged with the patient's need and better understands what it's feel like to be their patients. So this is about the education portions. There's a lot more software out there, but this is a few I can mention. Now let's jump to surgery. This company, Orthopaedics, using augmented reality in spine surgery. I actually got familiar with this company 4 years ago, just before the COVID hit. And this company is augmented reality surgical navigation pioneers that aim to improve surgery outcomes with cutting edge of augmented reality technology that solves unmet clinical needs and install technology confidence in the surgical workflows. What is really unique about this device is allows surgeon to accurately guideline instrument in the OR room in real time while looking directly at the patients like they have an X-ray vision. So there's a short video I'm going to show you in a second that actually demonstrates the beauty of this thing. Let's make it light over here. So like I said earlier, the X vision allows the surgeon to accurately guide instrumented implants in the OR and they get a feedback live. This is how the headsets look like. So when you put the headset, and actually I try it, and if you have access to a spine conference, go ahead, stop in the booth and try it. So what the surgeons see basically, see the patients. Now at the top, you see an imaging of the X-rays, and then he has a probe, that the probe is actually overlay on the patients. And now you can see exactly the angles that you want to drill the screw in, basically how deep you're gonna go and do it. And it's give you a real life situation. One thing that this company is doing is actually eliminate the need of the surgeons to go look up on the screen, look up the X-ray, then get back to the patients, try to reorientate it, the position. And this has got everything in one augmented reality procedures. Now you go, you drill in the screws, and then you go on level and do level after level. Now, this has actually changed a lot the way spine surgery has been done. Spine surgery, back in the days, and still a couple of surgeons using it, to get access to this spinal process and the vertebra, they used to go and do a big cut in the center of the back, clean the first hour or two, just clean all the ligaments, muscle, and everything, get a full exposure to the muscle, to the bones, and then orientate themselves and then try to drill the screws in. Now these days, with minimal invasives and reality technology, instead of making a big cut, the surgeons just come and do like one small tiny cuts in the middles, and this is obviously going to help with a better recovery. Everything you see in the goggles can be presented on a TV next that you can use by residents or medical students to go and get a better understanding of the surgery procedure. So very cool technology, X-ray vision kind of a thing. Another company is Pixie Medical. With what they're doing a similar things in total knee orthoplastics. And they come up with a device called the Knee Plus, which is used during a total knee orthoplastic operations. And it's offer the surgeon an intraoperative assistant for the implants positioning with the help of augmented reality glasses. So the way they're using it, and I don't know if you guys are familiar with total hip replacement, what needs to be done when you're replacing your knees, you actually have to chop some of the femur and some of the tibia, and then put a new implants in. Now, whenever you're chopping the muscle, the bones, you have opportunity to actually correct the angles of your knees. If the patients got injured because they have extra valgus or extra virus, basically, you can actually correct those in the VR. And this is what the augmented reality here can help us. So the Knee Plus companies, what is actually helping us to do is actually help the surgeon to place the implants on the femur itself, on the head of the femurs. Then you take in the leg through several motions until it's calculate where is the knee joint center is. Then you're putting another device on top of it, which basically telling you where is the optimal cut. And here, what you can do, you can actually correct the patient's varus or valgus angle and flexion angles in the knee. Then after you're happy, you just tilt the surgeon tilt the head. Actually, they have accelerometer in their goggles. You pin out the device, and then you just cut the bones to the appropriate things. Then you put the implants in, you obviously calibrate everything, you check that the right angles are in, and then you put the implants in. Then you're doing the similar things for your shank. This one, you have to have a device to find the ankle joint centers. So by knowing the knee joint center and the ankle joint center, you can calculate the expected varus or valgus angle, and then you can put the implant in. So definitely, extended reality changed the way we're doing surgery, giving us more stability and more accuracy in our surgery. Then let's talk about telemedicine. Well, this is the future, and unfortunately, getting out from this COVID-19, telemedicines are here, and it's going to stay, not going to go anywhere. Zimmer Biomet actually come up with a nice headset that we have a similar headset in the Studio X that called OptiView, the mixed reality. This system is marriage of real and virtual worlds to provide innovation solution, enabling surgeons and care providers to help to support the patient's educations, streamline to the patient some surgical planning, and to deliver demand and real-time support. So check this video.
Let's check out your Persona knee implant.
A patient's coming to your clinic, and instead of going through and explaining batch of imaging, just put the AR system head on and just show them what the procedure is going to look like. You're going to show them the implants itself and see where you're actually going to cut, what is the components of the implants, what the advantages of having a specific implants. Then going back to telemedicine, you can have a trainee sitting at the home or in your office or university and actually be part of the OR room and part of the surgery, when they can see everything the surgeon can see while they have demonstration of the device and in this example, using a robotic to do the surgery. Then one new feature I really like is that the surgeon can just put the headset on and then can objectively get motion analysis on the patients and actually track what is the range of motions the patients are doing. And in this example, the patients are in the office, but they can easily be done over telemedicine. And then we can track range of motions of the patients. If you are a medical trainee, you can always go, or a young surgeon, you can just go and review all the medical devices, all the procedures, all the anatomy you need to do. One cool feature this company, the Zimmer Biomet actually did, they're providing surgical training that actually take you step by step to go ahead and check how you put all the devices together. And again, no more spending hours in front of the screen and sitting in the office. You just go, wear this headset, stand up, be anywhere you want, and start analyzing the patients from a stored video they have, all the range of motion get analyzes, and see how it's correlates to the post-surgical outcomes. I know this company, the Zimmer Biomet, actually have a kit for knee patients, and they're now working for a hip system, which is pretty cool. Next, let's look about a different type of telemedicine, which is XR Health. XR Health is actually a company that you can use with your patients when you're actually sending a patient. Well, videos come. When you actually can send a package to your patients. XR Health actually changed the way rehabilitation is going through. So if your patient's suffering from any orthopedic issue, neurological issue, you can just send them a set, VR headset home with pre-programmed protocols. So they can just wear the programs and you take them through several exercises and maneuvers during the rehabilitation protocols. So here's in the examples. You can see a bunch of applications that the patients can go through, a bunch of different games. I mean, those having a virtual reality as part of the rehabilitation protocols found to be very productive, high satisfaction from the patients, and patients are more engaged in the rehabilitation program. One limitation for this program is that, as you can imagine, it's just working on the upper extremity and the core of the patients. Sorry about the delay of the video. It's working only on the upper extremity of the patients and some of the cores. But the beauty is that your clinician and therapist can get a real life information about how you're doing in your therapy and how much you're doing. Then a similar technology. Now let's move to the rehabilitation progress part of it. And now VR actually changed the rehabilitation portions. There's a nice company out of Israel called the Gait Betters. And with these companies actually turns any existing treadmill into a smart, personalized, and self-gait training system. This system actually offered the patients a scenario such as walking in a busy street, avoiding puddles, walking in the nights, and responding to attention-demanding tasks. So as you can see in the videos, you just put two sensors on the patient's feet. You have ads on camera for the system. Then you have one screen, so it's semi-actually immersive environment. You have one screen for the patients and one screen for the clinician on the sides. And then you can go all these gait protocols. This is used mainly for joint replacement patients in orthopedic amputations, patients, Parkinson, MS patients, or stroke victim. And here you can see how the cameras can pick up the location of the feet, and you kind of virtualize or augment those patients' feet on the screen. Now, one thing the Gait Betters actually did, they're creating a nice and friendly platform for the clinician to use to monitor and control and adjust the rehab protocols. Again, this is kind of very good software for gait training. However, is not covering the upper extremity and the core muscles. Reading a bunch of there's a lot of literature actually out there about this software that actually help a lot of patients to get the gait better and minimize fall risks. Another tools for rehabilitation, that's called Neuro Rehab VR. Actually, I personally know the CEO. She used to be a PhD student at UT Dallas, where I used to be before U of R. And she just came with this amazing idea. I decided to drop her PhD and just do this thing. So what she's doing, she's mainly working, this system mainly working with neurological disorder patients, spinal cord injury. And actually for this one, I'm going to use the sound for
and motivating.
Insurance only covers a certain number of therapy sessions, makes the idea of using virtual reality for therapy very intriguing. Through various immersive 3D environments, the patient can work on their cognitive as well as physical therapy at the same time, instead of doing each in isolation.
A lot of what we do as PTs is try to identify the biopsychosocial aspect of someone's life, really. When we're able to bring these people to this virtual world and fully immerse them in it, they can remove themselves from their actual reality to use their bodies normally, as they normally would, without impairment, regardless of what the impairment is, into gaining function that they once had. It's a beautiful thing. They really get to remind themselves who they are, build confidence, break away from their routine day. It's a learning experience for all of us. We're kind of in real time adapting and readapting to certain things that they can or cannot do. If someone has trouble standing up, getting them immersed in a world that they can stand up in whatever apparatus we have them in outside of it. They are able to move better, and you take things for granted when you have them, but for someone who really can't perform some of these things, that's the world.
My injury occurred.
So again, this is a great tool that is an adds-on to a therapist in a physical therapy environment. Basically, you can take the patients. I don't know if any of you actually felt some numbness or couldn't move the arms or the legs. I mean, this is can be very frustrating, and you can take those patients that don't have any controls or on the limbs or don't feel the limbs or have a chronic pain in the limbs and take them back to a real life situation, basically. And those patients get more motivated, basically. The rehab getting better, basically. They start to move better, and everything is can be shared with the physical therapy. Again, this device is specifically used by physical therapy, licensed physical therapy, to help them to deliver a better healthcare. Another version of it is a RealWise system. This company actually have more sensors on the patients. So if you see they have the headsets on the patients, they're also doing a better job on animating and creating new games. But they also have a bunch of sensors on the patient's trunk and hand, basically. I mean, similar idea like the Neuro VR, but this one, we actually have extra sensors that actually measure how much the patients are moving during the therapy. They create many more games over here. And the cool part is that the clinician or the physical therapy, more specific, can see what's going on with the patients itself. Okay, so now let's just move on to what we got. So this is a summary of what we got. All the products I presented are FDA approval and already using in the market. Now let's take all this information into account and see what we actually can do with it and what we try to put together here at U of R in our new motion lab. Just 1 second. My PowerPoint is frozen. Can you see, guys, my screen? My screen is frozen.
Yeah, I think it's frozen.
Yep. Okay, so excuse me for that. In just 1 second. You can just. Right. Just 1 second, guys. Sorry about this thing. So technology is great in VR until they're not working, basically. Okay, I can just jump straight on to this thing. Share it again. Perfect. We're back on. Can you see my slides now?
Yes.
Perfect. Good. So now let's take everything we just saw, right? And the advantage, disadvantages of all the devices we just saw, and see how we can make it better. We build the UR Medicine Motion Labs that we're trying to redefine the stability and functional outcome measurements objectively while advancing healthcare. So first of all, before we going forward, so if you're not, my screen is frozen again. Yeah, perfect. So first of all, if you're not following us on LinkedIn, please do so. We are providing a weekly updates of the cool stuff we're doing in the lab. We're also providing great literature review about new technologies and how we can use our engineering tools and VR tools in some specific ways to advance healthcare. So the Motion Labs is actually part of Orthopaedics and Physical Performance department when it's connected to the latest biomedical research, advanced cares, and technology. The Motion Lab in specifics assess disability and help patients to restore and enhance their functions. The lab is offering scientists, clinicians, and surgeons unparalleled insight into their patients' disability and movement functions. This is a portion of our mission statements. What we're trying to do, we're trying to get all the advanced disability and functional outcome measurements we're getting and try to combine it with clinical expertise, which is going to help us to determine ideally patient-specific treatment strategy and to make a better recommendation on when is the optimal times to return to work, return to functions based on the assessment that we are having. So we have 1,700 square feet labs. We actually broke it to five sections. We have the most advanced technology in the lab, which include human motion captures, which include marker system and marker-less systems. We have surface EMG and fine wire EMG to be able to objectively capture neuromuscular activity in our patients. We have several sets of EEG systems, these ones that you see on the right are actually a drying needle. We don't need any specific preparation or shave patient's head to read their brain activity. Then we have several force plates in different forms spread between the labs. And we also have an oxygen consumption system that we are using to capture our patients' oxygen consumptions. Here is a drawing of our lab, like 5 labs. If you didn't visit us, you're more than welcome whenever we open in the next couple of months. But I'll just go quickly through each lab. So the first lab is the traditional gait lab, where we're actually analyzing patients before and after interventions. In this example, we have a cervical myelopathy patients before the surgery, how they walk, and how they're walking after the surgery. In this lab, we're doing gait analysis for cerebral palsy kids, foot and ankle patients, or any patients that have any ambulatory disorders. We're also assessing patients' balance alongside ergonomics. Our second lab, which I'll discuss in more details later on, is our virtual reality lab. In this lab, it's contained a split belt treadmill. PowerPoint is full again. Split belt treadmill, which we can have. And next to the treadmill, we actually have a front of the treadmill. We have a screen with a projector on top of it. We have dimmers in the room and a sound system. We actually can mimic patients' life. I apologize, guys, in my PowerPoint. It's not to work today. Just 1 second, please. And thank you, Megan, for sharing the link for the lab. Yep. Okay, can you guys see my screen now? Not yet.
I think it might be frozen again.
Great, awesome. Okay, I'll just keep going while he's talking. So in our virtual reality lab, we actually, like I mentioned, we have a split plate treadmill. We have a projector system that actually simulate immersive reality for the patients. And then we have a attached harness system for the patients that are struggling of walking, just for safety information. And in this room, what we can do while the patients are walking, we can actually simulate real life experience for the patient. So for instance, if talking about Parkinson patients or stroke victim patients, what we can do, we can actually create some simulation when the patients have some objects coming to them and they have to march, like something similar you saw with the gait better system, while we can put some simple math problems on the screen for them to calculate, so do some dual tasking for those patients. I'm going to try it one more time. Then the third lab we have which I'll try to get the PowerPoints working again. Here we go. The third lab we have actually in our system is perfect. So now doing that. Okay, good. We back online. You see the stuff?
Looks good.
Yeah, perfect. So the third lab we have is a fall prevention and balance lab. When in this lab, we have it's called a neurocom system. What we have basically a half dome when the patients are standing on two force plates. When we can actually manipulate the surface with six degree of freedom, we can slide the patients forward and backwards, side to side, and tilted, while we can manipulate the environment of what the patients can see. I'm going to spend more time about this on this lab in a few seconds. Then our fourth lab we're having is injury prevention and tactical athletes. This lab is actually connected to our CHAMP department. CHAMPS is our sport medicines department. When we literally have a garage door that open up to a 50-yard dash track, a basketball court, and all this sport activity. In these labs, we actually helping athletes to perform better and try to prevent some potential injuries for the patients. We're also working with some military, firefighters, and police officers in this lab, trying to get a better equipment to improve their performance. Then our last lab is a wearable labs, where we actually handing wearable devices to our patients. If it's a Fitbit or a smartwatch or the cell phone or smart socks, or you name it, basically, or IMU sensors. And when we actually go into the clinics and giving the patients some sensors, and then the sensor can capture the patient's activity for a couple days, sometimes for a week, basically. Then we know that we are getting less information than what we can get in the motion lab. However, we can get a more continuous information of what the patients are doing while they're home, while in the hospital setting, while they work, and we can also quantify the quality of the sleep and everything. This is also can help us to work with athletes. We can actually put some sensors on the athletes and see our real life scenarios for those athletes, and also go to schools. You know, it's for those of you doing research to know how hard it is to bring kids to university setting. With the wearable device, with the wearable apps, we can literally go to schools and hand those wearables to these kids and capture some data on these patients. So most of our referrals and the patients we're serving are orthopedic patients with a foot and ankle disease, knee and hip, spine patients. We see a lot of pediatric patients and a lot of neurological disorder patients like cerebral palsy kids, Parkinson's disease. In addition, we see some stroke victim patients and diabetes patients. We have several different protocols for different types of disorders. Basically, the main one are listed over here, which including walking analysis, postures and balance analysis. We can analyze in different ergonomics analysis, how you lift, how you move from sit to stance, how you're working in your current computer environments, or just provide some performance analysis for our athletes. All of these informations, which is a lot of information, which is collect the 3D kinematics of the patients from the motion captures, some kinetics information from all the force plates, which basically including forces and pressures, neuromuscular activity and brain activity, in addition to collecting surveys on patients or patient-supported outcome, or basically how much pain the patients are complaining when they come into our visits. We also have a big database collecting our patients' radiographic, as you can see in the figure on the top right, when we actually analyzing patients before and after surgery, and we're also capturing a medication intakes. All of this information is going to the patient's charts for one output, and the second output, all of this going to our research electronic data capture for research for R&D purposes. Here's examples of our clinical disability and functional analysis reports, where here we're actually giving a snapshot to the physician and the clinician, basically, of the disability and functional level of the patient. So here you can see each column represent a different time points of the testing for the patients. It is before the treatment, or short-term follow-up, or long-term follow-up. And then in the gray column on the right, you can see values for age, gender match controls, or in other words, what is the goal, where we want our patients to be. And then we're running through a bunch of analysis, if it's how the patient's walking, balance, and lifting. So if I'm going in more details, this is the details report for walking analysis, where the patients come and just walk in our lab. And then we're providing some information on how fast the patients are walking, what is the stride time, how much time they're spending on each leg, lower extremity patterns of the hip, knee, and ankles. And this is usually heavily by clinician and physical therapists. And basically we try to see how the patterns is doing after surgery. Then we're doing extensive balance analysis, when we actually see when people are standing with the eyes open, how much they sway. If they sway, we see how they compensate for the sway. We're also doing some symmetry analysis. We can actually analyze on what portion of the time they're actually spending on the anterior front sides of the forceplates or the posterior side of the forceplates, and just provide a symmetry analysis for the patients. Now, like all the other reports, we're providing a different time points and different values for each test. And this can provide information for the clinician and the healthcare provider if the patients are doing better or not. Lifting analysis is also something we're doing, part of our ergonomics analysis, when we're actually analyzing a lifting style for our patients. And we can define if the lifting style is stoop, squat, or a mixed style. And we're mainly looking on trunk, hip, pelvic rotation, and how much the bending, the patient is bending over. Sit to stand or stand to sit in this example analysis, when we're actually looking of how much the patients are actually bending over, how much they use the hips and the muscles around the hips and the knees to move from sit to stand or stand to sit. So we're also looking at symmetry between sides, especially if you have a unilateral pain, where we try to avoid from standing from one side. We actually quantified how much pressure you apply on these forceplates. So now let me try to get back and talk about the virtual reality lab that we have, and in this lab, and hopefully this the slide is going to work this time. I would like to spend more time and more details about the 3 labs that we actually have virtual reality in. So the first lab, and this is the slides that we skipped, but now it's working. So we have a split belt treadmill. When we have the patients walking in the lab, and we have a giant screen in front of the patients, and then the patients can just walk through our real life simulations, right? In this example, in other examples, and this is actually also used by the Bertic Immersive Lab, the patients standing on 2 force plates, they have one sensor on the head, and they can actually play a game. They're actually working and swaying and kind of striking the core and lower extremity when they actually play the spaceships, and they try to get away from these asteroids and try to avoid from hitting. This can be a great part of the RIA protocol, working on core muscle activities. Now, let's think together how we can take it to the next level. So we have those force plates, we have those treadmill, we have the screen, the giant screen in front of the things. In addition to all the companies I just presented that focusing usually or on the upper extremity performance or lower extremity performance, we actually have the tools to work on the whole as a body as a whole and involve upper and lower extremity. We're right now in development to actually merging a motion capture system to trigger the virtual reality environment. So for instance, if one patient reach a certain level of range of motion, let's say we saw the example of patients lifting the shoulders, right? So if the patients actually reach a specific range of motion, let's say 90 degrees, then automatically the system can advance and go to a more challenging system. I mean, we saw some existing technology that actually allowed the physician, the physical therapy to control the intensity and the level over here. We're trying to make some automatic system over here. Besides that, don't forget, we have some EMG system, we have EEG system, so we can actually record how the brain of the patient is working and how the muscles are working, and we can make those as a trigger to advanced level, or maybe make some level much more easier. On top of that, We have if you guys not familiar, we have a great psychologist, Dr. Craig Cyphers, but we are also working with him on some sports simulation and how the patients is actually mentally get prepared for the battle or for the game. And one of the variables he's using is oxygen consumptions. And only when the heart rate is going up and the patient's using more oxygen, inhaling more, basically, he tried to trigger or create intervention to the patient. So we can do the same thing over here. We can create a virtual reality world with a sports environment or a battle environment or you name it, basically, and count on our input. If it's oxygen consumptions, if it's a neuromuscular activity, if it's a specific range of motions to advance or disadvance, basically, the program of what the patients are seeing. A third lab we've actually presented before was the fall and prevention balance lab, which is actually, we just purchased computerized dynamic postographic. And here is a short video of how this system is actually working. So this is actually a half dome with 2 force plates on things. And what we can do as a scientist and clinician, we can manipulate the environment. If it's like you see in the video, we can manipulate what the patients see and how the environment changes for the patients. And if you see the patient's surface is also moving in 6 degrees of freedom, so you can tilt the patients up and down, you can move them back and forth, basically, and side to side. In this example here in the video, the patients actually is the plane, and then they use some sway strategy and motor control strategy to fly the plane. Then on top of that, the system actually already have some clinical protocols. For instance, they have a sensory organization test. We can actually manipulate the environment of the test. This is actually a very dangerous test. They can cause vertigo for some patients. This is why you have the big red bottom on the left corner, the left bottom corner, if some of the patients gonna fade it at some points. They have a great protocol for motor control test and proprioceptive testing over here. But think about the potential that we have over here, right? I mean, this device is literally designed for fall preventions, balance, advanced balance testing. It's actually heavily used to detect specific balance issues that cannot detect by a simple clinical test like the Womberg test or the BEST test. And think about how we can manipulate and what kind of environment we can create for these patients. Now, take this one to the gaming technology we saw earlier, how we can create some advanced and fun gaming for our patients to basically advance their care. How we can challenge our patients with more gaming situations while we manipulate the surface and the environment on the same time. So now the third lab that we have is our wearable labs, and this is where we see the future of the telemedicine. We actually have a couple of grants using wearable devices that you can see in the bottom of the screen over here. We are using a couple of IMU sensors. We have access to some Fitbit sensors. Apple Watch, we're working on to get some project with them. We have the finger, the Aura Health, which actually the ring they can get. Now think about taking all these wearable devices and combining it with the existing XR technology we have at Studio X. We have actually, if you are students or faculty of U of R, you can go to Studio X and you can rent one of those devices for 3 days and just go and play with it and explore it. So we have the Meta Quest 2, we have access to the Meta Quest Pro, we have the Microsoft HoloLens 2, yet you saw a couple of the surgical and the Zimmer actually using this technology for their needs. But think about how we can take it to the next level, because all the rehabilitation protocols I just showed you are really good in tracking what the patient is doing while they're wearing the XR, the augmented reality system or the VR system. But as soon as they're taking the system off, we have no control or idea what the patient is doing. And we don't know if we actually beat the patients and kind of overload them with some work, or actually the workup we preload them to the system is actually not challenging enough for them. This is where the wearables in combination of the VR can provide us a lot more detailed information. So as soon as the patient's done with the treatment at home or the clinic, the wearables still keep continuing collecting data about the patient's functionals and disability levels. So we can see what the patient is actually doing after finishing this rehabilitation protocol interventions. Maybe they get beat up and they go to sleep for 3 hours, or maybe it wasn't challenging enough for them, and then go and decide to go to the gym or for the park for a walk, basically. So again, think about the potential that we have over here, combining extended reality with telehealth, with wearable, basically, to advance medicine, specific telehealth. So I'm going to conclude my talk with repeating our Motion Lab vision and mission statement. And I'm mainly going to focus on the last portion of the mission statement of our lab. I mean, one of the goals of the lab is developing innovative rehabilitation techniques for patients with musculoskeletal and neurological disease. Thinking about the data we can get from the extended reality, from the virtual reality, the headsets, or the augmented reality, in combination to the motion capture that we have, the neuromuscular activity, all the forces, kinematic and kinetic data we can have, oxygen consumptions, brain activity, takes all this information together and combine it with existing clinical and radiographic measurements. And this can help us to create a better way for a patient's specific treatment strategy, and make a better recommendation for what is the optimal time to return to work or return to functions. And again, we have a lot of inputs. We're going to put a lot of devices on our patients, but this is the future. I mean, as you saw, telemedicines, rehabilitations, augmented reality, and virtual reality. This is changing the way we study for medical school. This is changing the way we're treating our patients. This is changing the way we're doing surgery. So if this is the future, let's take advantage of that with the advanced tools we have in our lab. So before I'm finishing my talks, basically, we are actually hiring people to our lab, basically. So if you like our talks, and we want to be part of the thing in fashion, we will be a full-time. We're hiring motion lab engineering tech. If you just want to jump as a project, as part of your thesis or dissertations, you are more than welcome to be with us. And we also working on interns for a short term, if it's for a semester or two. If you are interested in that, just holler at me, just send me an email. This is our information over here. Make sure, so if you want to stay up to date, make sure to follow us on LinkedIn, is where we're mostly active. And that's about it. And then I'm going to open the floor for questions.
Thank you, Dr. Haddas. It's really cool projects. I really enjoyed your talk. And yes, I'm wondering if there's any question from the audience. You can either just speak up, ask your question, or put it in the chat, and I can read it for you. Oh, yes, go ahead. Yeah.
In your very first example of spine surgery, what wasn't clear was how you did the 3D registration of both the spine and the surgeon's head, so that you could do this merging in real time. That's the real technical accomplishment there, I think.
Yeah. So definitely, this is based on an input from a CT and X-ray scan. And this is way above my level, how to connect these two, basically. But the way we do in surgery definitely a change. I mean, there's a bunch of papers out there using this technology for accuracy, which actually minimize the complication for patients after surgery.
In the neurosurgical context, they use like 3 globes and then identify where the 3 globes are in the operating room. And they know the distance between the 3 globes and the tip. And they're able to identify exactly where they are and register the patient with the MR signal. But that particular application requires knowing where the individual's head is also.
Yeah,
you know,
so obviously
very challenging.
Yeah, there's a calibration process you have to go through. I don't know if you saw on the probes, actually a calibration tools that show you everything. And again, I'm not an expert on this technology. I'm not part of this company, but I can definitely reach out and get more information about it.
Are there standard protocols for the 3D headsets, or is it all manufacturer dependent?
So they're actually independent. So each of those, since it's very new and not like a strict regulation on it so far, each of the company kind of building their own things based on the surgeon's needs. So you saw the headset for the spine surgeons using a different technology than the one for the knee surgeons, basically, because they have a different needs. All the technology I presented today actually is FDA approval. But is many more out there that not FDA approval yet. They're doing great work over there. But to answer your questions, each of those using based on the user needs and experience.
Sorry, go ahead.
No, go ahead. I was just going to point out that we have the visible human data sets and are able, which were generated through serial sections of cadaveric samples, and have installed these on supercomputer and very large workstation environments, and they're now accessible for 3D reconstruction of actual photographs of planes, which are readily available for download, but also are feasible, so that instead of getting surface rendering of muscles, such as in that beautiful dynamic dissection, you can actually conceivably use actual photographs of anatomical sections. It's another local capability, but we don't have the ability to take it into a headset because there are no drivers.
Yeah.
For the headsets, that's the challenge at the moment.
Yeah. I see these couple questions on the chat. So where I can find the job posting. So we're putting all our stuff on LinkedIn, and your job at the HR website. And if our residents have an access to the motion lab during the training, I know that the residents actually have some research rotations that they can use those research rotations to come and work with us. We actually have already a few that contact us, but definitely yes. This lab is part of U of R, so if you are U of R students or trainee, you can have access to the lab. Just reach out to me with an email, what you're hoping to accomplish, and we'll set you up with what you need.
I had a quick question.
That has the hands up. Yes.
Oh, sure.
Ahead.
Yeah, I'll go. Thanks for the great talk, Ram. So we work on EEG signal analysis in my lab for things like motor imagery classification, and then we did some work on stroke rehabilitation with EEG, or using EEG as well. So you mentioned EEG in a few places in your talk. Can you give me a few examples of how you use it either in the clinic or in your research?
Well, the EEG by itself or the EEG with the VR?
Well, either one. So in the context of your work.
Yeah, so it is a great question. So thank you for that. So the big example I was using is Parkinson patients. With Parkinson patients, they have things they call freeze gait. When basically you tell them ready, set, go, and then the patient is not moving for a couple of seconds, 3, 4, 5 seconds. We don't know if the patients actually accept our trigger, that they actually hear it, or maybe they have an issue with the hearing, or maybe the issue with the muscle. So one thing we actually very interesting to find in these specific patients, or basically any other neurological patients, is that if they actually receive the command from us and the brain is processed, so we can tell, we can start eliminate where the problem is. So if we see that the brain got some activity, so we know the brain processed the signal. Then we're going down to the muscle activity, right? Because the muscles are going to perform next. Even if we're not moving yet, we can see some activity in the neuromuscular system. Then the patient is still not moving. Then only when you start moving, this is where our motion capture is coming in and tell you how much they're moving. But it's literally the 3 to 5 seconds of freeze gait that are really interesting to see what's going on with the patients. Another example is concussion patients. I mean, we are working with athletes that actually unfortunately got injured. We want to see what is the best and optimal time for them to clear them to get back to sports, basically. We can create some different reaction. And this is where actually the VR system can help us to mimic some sport intervention and see if actually if the brain is functionally like it's supposed to function, like a normal person. If it's a normal brain that we can define.
The Parkinsonian patient example that you gave is really very interesting, because if you put a grid, essentially a series of stripes in front of the patient, they can initiate gait. So in your simulation environment, you could essentially put a striped grid in front of the patient and move it, and they should be able to start to walk. And following the neural activity in that context would be very interesting indeed.
Yeah, thank you. And this is why we build this lab. So again, the lab is provide, first of all, it's provide clinical services for patients, clinicians, but it's also and therapists. But it's also we have a big components for research into it. So that we have all these tools that can be used for any of our U of R students, faculty to come and try to advance healthcare. And I'm very excited when I met Megan and Emily a couple of months ago about the collaboration that we can have with Studio X to advance healthcare, develop new protocols. I mean, I met with a couple of the students, very talented students, and we're really hoping to get a couple of those in our lab, help us to advance science and healthcare.
There is another question in the chat. I'm very interested in learning about VR for sports, especially golf, to train golfers in specific motions and know how those motions might help performance and reduce injury risk.
Yeah, so the golf, everybody like golf here. I already figured it out. This is what we do in Rochester. Yeah, so we have, so this actually will go through our CHAMP program, with a sport medicine program, but they're actually gonna go and build with you a specific program, how to make your golf swing better, look on a specific analysis. Then one of the stops for this program will be actually stopping in the motion lab, where we create some specific analysis of how you swing, basically. Torques of your trunks, what we know is actually big risk factors for golfer, basically. I mean, all the patterns, like starting all the kinematic chains, starting from the ankles and how you start twisting, the hips, the trunks, the pelvics, the trunks, all the way to the clubs. So this is how we do. Now, how to get it to a VR technology? I guess this one, since it's part of the CHAMPs, we cannot use our virtual reality lab. We actually need to borrow one of the Studio X headsets and just mimic a golf situations. I mean, what I'm really exciting to do, and what we're doing is to connect our human motion capture system to a VR system, and then control the environment based on the patients, on the athlete movements.
Another question in the chat posted earlier is, which technology is the most advanced? What state of the impairment would the lab assist the best, more applicable early state of impairment? And great presentation.
Yeah, thank you. So these are tough questions. I'd like to ask you, what of your keys do you like the most, right? It's really hard. All the technologies are great. Each of them measuring specific things that can help us to build the whole story. One cool things we did in our motion labs here at U of R, we actually purchased all of them together, and then hopefully within a year or 2 years, we can find the optimal combinations for a specific patient types. And I can tell you right now, technology that's working for Parkinson patients may not work for concussion patients. Right, patients that need some gait training probably will not benefit from fall prevention lab, basically, because they need more specific gait training for the needs, basically. So which one is the best? I don't know yet. They're all great. But I think it's not who's the best, it's again how you apply and interpret the data from each of those devices, basically. Who has these questions? Melinda, right? If you are U of R students or faculty, you're more than welcome to come and visit and help us to see which one is the most advanced for your needs, basically.
I saw Burrs who has their hand up. If you want to ask the question.
Yeah, Bursu.
Oh, we can't actually hear you. If you are speaking.
Right now?
Yeah, now we can hear you.
Oh, okay. Thank you very much for this great presentation. I'm sorry if my question is a bit similar to the others, but I'm a bachelor student. I'm a bachelor physical therapist and an XR student in Germany. And in the future, I want to use XR for the physical therapy. So I'm a first-year student. And do you have any tips that I should follow? Because like I said, I'm the first-year student. And there are way too many programs and too many languages to learn. And which qualifications I need before I apply the job, or what should I follow?
Yeah, so you're locally, you're in Rochester or in Germany?
Oh, I'm a physical therapist, bachelor physical therapist. Okay. And I'm a first-year student in expanded realities in Germany.
Okay. And what are you trying to achieve to be a physical therapy? Or
actually, I want to use XR in physical therapy.
Yeah.
Because I have a knowledge of the physical therapy, and I'm learning the programs and the others, so I can connect two of them together. I wanted to do that.
Yeah, absolutely. So I think the best way to learn is to use it. And you can ask Megan over here how many times I actually stop at the Studio X to borrow a system and just try and play with it. So the more you get exposure to it, I think is the better. I'm not sure if you have access to one of the headsets in university, but those are actually not that expensive to buy if you need, and may worth the investment. So I think the more you use it, and the more if you can go and do an internship with one of the clinics around it using extended reality or virtual reality system is the best. Like I said, the more you use it by yourself, it can create more empathy and more better understanding of what the patient is going to go through, and then you can also get more familiar with the protocols that are available or not available to others. I mean, one of the companies that presented the neuro VR from Texas, from Fort Worth, Texas, is actually one PhD student that started her degree and literally quit because she had very interesting idea how to take rehabilitation to the next level. So I think the more you use it, the more you get exposed to it, this is the better.
Oh, thank you very much. We have an access to our VR lab. And I mean, we have a VR lab and we can use the headsets inside of that class, inside of the lab. So, okay, I will try to work more on that.
Yeah, you're welcome. And on top of it, I know you can reach Megan after that. We have some content available online from our Studio X that you may help you, or at least to guide you to the right location. So please reach out to our Studio X in University of Rochester. And
thank you very much.
You're welcome. Yeah, I see one more question from the chat from Alex. Great talk. Do you have any vision for utilizing your motion capture and XR system to assess or improve surgical training? For example, strap sensors for surgical residents while doing cadaver labs and physical VR simulations. So actually, there already existing company that using. I just saw it this morning on my LinkedIn. I'll be happy to send it to you. But the whole medical training changed now thanks to the VR. Right now, we can use, when you're talking about motion captures, right now all the VR system have like two remotes, right? You can put on your hands, or actually if the XR, they can actually capture your finger motions to actually capture and track your motion and what you're doing. There are existing, like I'll find the company, Alex, and I'm just gonna email you the company. They are actually using this for, and it's actually FDA approval, and they're using it in a bunch of medical schools already to practice surgery, basically. I'm gonna find it right now. Sorry, I missed any questions or any?
I think there was one from Wallace asking about where they can find the job posting to some of the opportunities that you've mentioned.
Yeah, I just mentioned. So usually putting all that stuff on LinkedIn, the lab LinkedIn basically, and then the official one is on U of R HR job website, whatever is there. But usually everything going on our LinkedIn. We're very active on our LinkedIn. We're putting like at least once or twice a week posting, including how ways to join our labs. If you don't find it, just send me an email what you're trying to achieve, what you're doing right now, what is your goals, and I'll be happy to build you up a program.
We're happy to share any of those job opportunities on our Discord. So we share those types of things there as well.
Wallace is asking, will you be posting the jobs soon? It seems there is no jobs up there right now.
Yeah, so we actually right now we're interviewing for our summer internships. I don't know what is our Walls level of education, and then we are probably in next week or two going to post 2 lab technicians position, engineering lab technicians for the lab probably in next week or two, starting next semester as well. If they are PhD or master student to just do part of the research projects, we are always open and welcoming new ideas, new brain and new blood in our labs, basically. And again, we really, I think we're really exciting about the collaboration with Studio X and different departments that we have in university, and we're really aiming to advance healthcare using augmented reality and extended reality technology. Any other question before we concluding these sessions from anybody? And again, I'm sorry again for the lack of the struggling with technology. You know, my talk is about technology, and then I cannot even work a simple PowerPoint. So I'm sorry about it. Again,
I think all the previously posted questions are answered. Yeah.
Yeah. Yeah, and again, if any of you if I was able to trigger any of the ideas, I mean, if you're a clinician, if you are computer science students, if you are just engineering students, and you have any cool ideas, I mean, please reach out. Like I said, we spend a lot of resources to get these motion labs in place. We are looking for collaboration, and we are looking to advance healthcare. So it's a great opportunity over here for everybody. Please reach out.
Thank you so much for the inspiring presentation showing a very big potential of XR technology in healthcare. Many very exciting directions to go. Thank you, Dr. Haddas. And we're very grateful to have learned about all your work. And thank you also to everyone who joined today. If you would like to continue following Dr. Haddas' work, please follow him and his lab on LinkedIn. Information is in the chat. There are many links there. Please also check out the rest of the Voices of XR Speaker series. Our next speaker is Damien McDuffie, who is a creative technologist and the founder of Black Terminus AR, a camera app and no-code AR studio in your pocket that brings archives to life. That link is also in the chat. And thank you so much again for attending today's talk. I wish you have a wonderful day.
Thank you, guys.